Hello everyone and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. My name is Ann Potempa and I help facilitate these webinars for the section. The primary aspects of our work include health promotion, chronic disease and injury prevention, and data collection and surveillance. This webinar series was created to provide a way for us to talk about our projects and explore how we can work together. We will be offering these webinars on the third Tuesday of every other month at 1 p.m. Another way you can stay connected to our work is through our newsletter. You can sign up for the newsletter on our section's website, which is on the first slide of this presentation. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes. A 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants and the slides will be made available within the next week. Audio will come through your computer. You also can call the number that was provided. If you need help listening or watching this webinar, please let us know by using the question function on the control panel. To ask a question, you will need a microphone or you will need to call into the number provided. Please hold questions until the end of the presentation. Today you will be hearing from Regina McConkey. Regina will be talking about her program's work to create new public education materials to address opioids misuse and abuse. Thank you, Regina.
Thanks. Hi, everyone. As Ann said, this is Regina McConkey. I am with the Office of Substance Misuse and Addiction Prevention. We are a brand new office as of July 1st within the Alaska Department of Health and Social Services. And I'm grateful to be giving this presentation from the Section of Chronic Disease Prevention and Health Promotion's webinar here because a lot of this work started within this section. I was originally actually housed in this office. Thanks to the person who noted that I should speak louder. Just give a shout if you still can't hear me. Thanks. So first, I just want to acknowledge that these efforts exist within a larger scope of communication efforts for a variety of different audiences. Today, we're going to be talking about our prescription opioid misuse prevention messages. And these are for all Alaskans, but we also have messages, and I'm not going to go into all of these, I just want to acknowledge them. Efforts for people with opioid use disorder, including those who are in recovery. Messages for loved ones of those with opioid use disorder. For youth, and for prescribers and pharmacists. So again, this presentation is focused on just general messages for all Alaskans on prescription opioid misuse. We have some primary research that informed this campaign. There were focus groups in 5 communities between March and April of 2017 to understand Alaskans' knowledge, attitudes, beliefs, and behaviors. And we just talked to folks who had been prescribed an opioid at any point in their life, and we learned a little bit more about how they used it, what they did with it when they were done. The first round of focus groups just had general key questions to gather information. And in the second round of focus groups, we talked to folks about specific messaging and tested messages that would resonate. And we also had a telephone survey in June of 2017 just to set a baseline for these education efforts. And we're going to loop back in January of 2018 and gauge what's been effective and just see, how we might need to change some of our messaging as we go forward. So there's a lot of media out there about opioids. We all know we're seeing it in the news every day. We're seeing stories about prescription opioid misuse, about heroin, about overdose. But there's one challenge for Alaskans, and they don't always know what a prescription opioid may be. So, if they're not able to recognize prescriptions that are in their medicine cabinet that are opioids, then we have a challenge that we need to talk about here. So in our telephone survey, we recognized that roughly 20% of Alaskans did not know or weren't sure that codeine and hydrocodone were opioids, and those are commonly prescribed opioids. And around the same number didn't know whether the antibiotic amoxicillin was an opioid. It isn't. And roughly half weren't sure whether fentanyl is an opioid, and it is. So this is definitely something that should be really easy to solve. You know, there's a lot of educational messages out there about prescription opioids, so we just need to help improve recognition of opioids. Here's some messaging that we are recommending. And so I'm going to go through each of our messages and hope that these are helpful for folks who are doing similar work. They can borrow anything they want from us, and we'll be providing a lot of materials that folks can use or that we can regionalize. But I just want to give the overview of these messages, and I'll loop in some of our media as we go. So we like to include a message that calls out some of the generic prescriptions, medications like hydrocodone, oxycodone, morphine, fentanyl, and codeine, for example, in one of our ads here we're going to talk about. And in just a minute, we'll show a video that this digital ad is linked to, but I'll just read through the digital ad here so that you can see. Living in Alaska can toughen you up, but sometimes you get hurt. If you're prescribed opioids for pain, be careful. Hydrocodone, oxycodone, morphine, fentanyl, and codeine all can be addictive. Talk to your doctor about the risks. So this is just an example of one of the ways that we kind of key in some of those names. Sometimes when we don't have space, we just say prescription pain medications, which is another option. So the talk to your doctor about the risks conversation. Some of the messages that we're encouraging patients and providers to touch on are treatment goals and a plan to stop use. Risks of addiction, for instance, if you have a family history of addiction, that's a really good thing to be clear with your provider about so that you can consider alternative treatment methods, side effects, and handling of prescriptions. And, excuse me, prescribers and pharmacists are busy, and they may not always have the opportunity to initiate these discussions. So what we're hearing is that they'd like materials that they can give to their patients to take home. So we've created some media here, for example. This is a brochure, and this is available for use, and it can be regionalized, which we'll talk about a little bit more here in just a moment. But this includes a message that your provider cares about your health and safety. If you are in pain, you'll work together to determine the best possible treatment for your condition. Please be sure to discuss. And here we just have some of those messages that we just talked about. Conversations that you can have before you're prescribed an opioid and things that you need to consider if you are prescribed an opioid. And there's some more messages here on the right of this that we'll go into in just a little bit for this material. But first, I'd like to show you our television PSA. This started running Monday of this past week, and this will continue running through the spring. This is one of 2 television PSAs we'll show here today.
Living the Alaska life can really toughen you up. Sometimes you get hurt. Opioids such as hydrocodone, oxycodone, morphine, fentanyl, and codeine may be prescribed for pain, but opioids can be addictive and should only be used as directed. Talk with your medical provider about these risks and how to safely start and stop your medication, or ask about other options to manage your pain. Learn more at opioids.alaska.gov.
So that wraps in a lot of those messages that we just talked about, recognition of prescription opioids and patient-provider conversation. Let's see, how do we get to the next? Oh, there we go. So our next messages are social availability messages. You know, of course, one of the reasons that we're talking about prescription opioids here is that opioids, when diverted from their legitimate use or used other than the ways that they're prescribed, can be dangerous and can, you know, oftentimes that is the way folks are using them before they're using heroin. So that's, you know, messages about safe storage, disposal, and not sharing opioids are really important right now. And this is this is a banner that we use for an event, but this is just a way that we've been lacing in some of these messages, and we'll go through each one individually here. Secure storage. So some of the messaging we're using here is securely store all medications, especially opioids, out of sight and out of reach of children, teens, and others who may misuse them. Keep track of medications so you know if any are missing. Properly dispose of unused opioids instead of saving them for later use. And all of the focus groups participants that we talked to indicated that they agreed it was the responsibility of a person with a prescription to store them in a protected place, yet only a minority indicated that they personally needed to store their opioids in a safe place themselves. Preventing youth access was a clear motivator for many participants. So this is one of the messages that I think might be a little more difficult to move, and hopefully we can get some more support from community partners to help reinforce this message as well. Proper disposal of unused medication is another message. So we're noting that you need to properly dispose of unused opioids at a drug take-back location or event, or learn more about other disposal methods, such as medication disposal bags specifically designed to deactivate opioids at opioids.alaska.gov. Now, opioids.alaska.gov is still being worked on a little bit, but we'll have a lot of these messages up there as well. And this is really where things get pretty complicated from a statewide communication standpoint, because the infrastructure for disposal is very different from community to community. So for example, here's that brochure we talked about, and this is what my statewide disposal message looks like, and it takes up quite a bit of real estate. It's kind of a best, better, good approach. So the best option is to take it to a drug take-back event. Well, drug take-back events and locations are kind of limited in some communities. So we have the drug disposal bags. And for those of you who aren't familiar with those, there are a number of different agencies distributing those, and the state is as well. And these are bags that contain activated charcoal, and you just add your opioids and you add some water, you shake it up, seal it, and you can throw it away at home. And then the other option, and just kind of the fallback option really, is the kitty litter or coffee ground method. And you can read a little bit more about that on here later if you wish. And then of course we're always noting, don't throw your opioids away without using one of these methods, and never flush your opioids down the toilet. And here's the final message. Don't share your prescription opioids with anyone. Don't share them with family, friends, or anyone at all. It is not safe for others to take. Storing opioids may cause addiction, trouble with the law, overdose, and death. And the sharing conversation is one that's going to take some work, because we have some cultural considerations here. Alaskans don't like to get rid of things. Our focus group participants had many reasons for hanging on to opioids, and a lot of them had to do with concerns about being in the backcountry and needing them for adventures such as snow machining, hunting, and hiking. And I think, you know, there could be some opportunities for some messaging about why maybe it's not the best idea to offer your prescription drug for use for someone else who it wasn't intended for, especially when you're in the middle of the wilderness, away from access to emergency help. And there's also the concern that it can be difficult to get things in rural communities. That was voiced quite a bit, and we're in a sharing culture, so we all look out for people who are in need. And again, that's another, that's one of our messages here that we need to address. So one of the things that seems to be really effective in our conversations with focus groups was to let Alaskans know that the problems they're seeing, the opioid crisis they're witnessing, there's many things that they can do from home. And drawing that connection between prescription opioid misuse and the effects they're seeing in their community to actions they take at home, such as reducing drug diversion by getting rid of unused opioids and reducing the unnecessary risk for themselves and their community, is one effective approach. And there was also another message that seemed to resonate pretty well, is that you're personally responsible for your prescription. And so as soon as that enters your hands, it's your responsibility to make sure it's not misused. Here's another one of our television PSAs that started last week.
In Alaska, the things we need are sometimes hard to come by. It's why we hang on to stuff. And when others are in need, we share what we have. But when it comes to prescription pain medications such as opioids, sharing devastates our community. It can lead to addiction, trouble with the law, overdose, and death. With opioids, not sharing is caring. Store and dispose of your unused medication properly. Learn how at opioids.alaska.gov.
So the television PSAs and radio PSAs will have statewide placement. Public radio is run here for a little while. I have some scripts for anyone who's interested in producing their own radio PSAs. They're welcome to use the scripts that we've already produced. We also have commercial radio based on these television PSA, the audio that you just heard. And we'll have digital ads that will come up on mobile and tablet. We'll have YouTube placement, Google AdWords for folks who are searching about opioids, and we want to direct them to opioids.alaska.gov. And we'll have social media posts. I saw a question come in about whether we were posting on social media. Yes, our department will be. We'll also have a post bank that I can share with partners if they just want to collect some of those posts and put them out, on their own schedule. They're welcome to. And we'll have quite a bit of print media. Here are some examples of some of the materials that can be used. There's a billing insert here that can go out through, utility mailers. Providers are welcome to put them out in their billing. And the front side of it is what you're seeing here, and it's those social availability messages of not sharing, storing securely, and properly disposing. But on the back side, we have some messages about patient-provider conversations as well. And I don't have any of those printed, but folks are welcome to the files if they'd like to print them, and we can certainly coordinate some efforts if we need to. And then there's a rack card template here, and this is where that disposal messaging is. Again, it's just complex, and different things are available in different communities. So I'm hoping that we can partner up and kind of get a little bit of a better idea of what's available in your community. And on the back side, it will have specific information on where you can go to dispose of an opioid. And then this is a poster that we've put together that can go in hospital settings or in doctor's offices or any other purpose that folks can see. And we're doing our best to be out in the community. Governor Walker's office allowed us to use his state fair booth to get out some messaging about the impacts of opioids, including heroin, in Alaska, and some of the things that people can do in their community. We were able to give out some drug disposal bags. And we had on the back wall just this banner here where folks could leave notes to talk about how substance misuse had affected them or affected their community. So thanks so much for listening in. I'd like to answer your questions as much as possible, and I may not be able to answer all of them because my scope here is a little limited, but if I can't answer them, I'll try to get them to anyone who can.
So this is Ann Potempa again with the section. Please feel free to use the question box on your screen to type in questions. If you have access to audio, you're welcome to speak through your computer's microphone and ask us questions that way.
So I see a question about drug interactions or interactions with alcohol. Yes, our provider brochure that you saw does have some information about having honest conversations with your doctor about possible interactions, but it would be good to include some interactions, some drugs that that can lead to overdose when combined with opioids. So that's a good suggestion. We have another question here about who you can contact to obtain medication disposal bags. You can go ahead and send me an email for that, and I'll get that to the person who's coordinating that effort. Again, my email address is regina.mcconkey, here it is, regina.mcconkey@alaska.gov. I see a question here about customizing rack cards. Again, just send me an email for that, and I would love to coordinate with you on that. And I see some ideas here on potential placement. Hi, Suzanne. Thanks for coming in. I think that that's great, and I'm open to ideas that folks have. We do have an opportunity to make some more versions of these materials, so absolutely reach out. Yes, I see a question here about whether the webinar recording will be shared, and it will be saved here so that folks can revisit it. I see a question here about what the Facebook page name is. Right now, we're just using the Alaska Department of Health and Social Services. We'll be posting through there. So if you follow the department, you should see some postings there, but I can also reach out to folks who are interested with a bank of posts that can be shared on their own timelines. I see a question about strategies for targeting high-risk demographics like homeless youth. That's certainly a conversation that I would like to continue with you, so it would be good to reach out. Our youth-based education efforts right now are focused on school-based education, and we do have some educational efforts for people who have opioid use disorder, and so some of the messaging may cross over well to the folks that you're working with. And I see a question about how to access these resources. Again, just go ahead and pop me an email, regina.mcconkey@alaska.gov. I see a question about how many individuals were in our initial sampling group for our focus groups. We had between 8 and 12 participants in each focus group, and we had 2 rounds of 6 focus groups in 5 different communities. So we had quite a few folks involved. Do we have information about opioids and tobacco co-occurrence? I would have to get back on that one. Do we have plans for testing messages for teen audiences? Yes, we have some ideas in place. There are a couple of youth groups that we've talked about meeting with, and that's perhaps a different conversation, but you're welcome to reach out if you're interested in participating. And I think is that all the questions we have for now?
We have another minute or two if you have any more questions for Regina. Otherwise, I know she'd be happy to answer any questions that come up later at her email address, which is again on the screen. Other than that, a reminder that our section will be sending out an email in about a week when the webinar and the PowerPoint get put on our section website. On our webinars page, you can always go backwards in time and look through the webinars over the past few years, which are archived there for you. And everybody, whether they participated or not or registered today, will be receiving that email from us.
There's a question here about whether the focus groups were geographically diverse. The focus groups were in areas that had higher rates of overdose, and that included Mat-Su, Juneau, Anchorage, Kodiak, and I'm forgetting someone, Kenai. And we did have folks in our focus groups who had been in more rural areas, but we didn't go any more rural than that. We did have, limited funding, and we're combining it with an effort for another project as well. I think that answers all the questions that we got in here.
Well, thank you, Regina. We appreciated that webinar today, and this will be saved and recorded for later. And thank you, everybody, for participating.